And now, if we could please have Strados Labs.
Hi everyone, my name is Nick Delmonico and I am the CEO and co-founder of Strados Labs. And at Strados Labs, we believe in building a better way to manage respiratory health. I'd like to introduce to you Tamara Mills. Tamara Mills was diagnosed with asthma at the age of 10. For the next 3 years, would travel to the ER 47 times for asthma-related exacerbations. She never ended up making it a 48th time because she ended up having an asthma attack in her home. And the biggest problem here wasn't that not enough was done that 48th time, but not enough was done the first time, the 7th time, or the 47th time that she ended up in the hospital. There's a massive data gap between the information that providers have about their patients when they're not in the hospital and what asthmatics have to better understand their signs and symptoms of lung health. And as an asthmatic myself, I understand personally how hard it can be to really understand your signs and symptoms, especially as a kid, and what kind of toll that can take on your parents. We aim to create a better way to manage respiratory health, and we're gonna do that with our device called PulmoWare. PulmoWare is a lung monitoring device that's worn on the chest or back and will provide meaningful information back to both patients and even providers that can help them better identify their signs and symptoms, improve compliance rates with medications, and ultimately can save money by fewer ER visits and hospitalizations. Essentially, it's like an electronic stethoscope, but we're making it smarter, wearable, and more user-friendly. And we're creating algorithms in the back and that really understand what's happening in the human body at any given time and sending that information back to patients and their care teams to better manage respiratory health. So how does it work? It's about the size of a watch face and it sits on your chest or back. You sync it to your smartphone and you go about your day. You can be in class, you can be at work, you could even wear it when you're sleeping, and it's actually identifying lung sounds in real time and sending that information back to your phone. It allows you to monitor trends in your health. It identifies wheezing, coughing, shortness of breath, and allows you then to take action. You can take your inhaler, for example, avoid triggers for asthma-related health, pollen, pollutions that might end up making your asthma worse, and ultimately, you can send this information back to your provider if you'd like. And there's an opportunity for providers to have a platform for which they can manage their patients at any given time to understand their respiratory health. We've talked with dozens of providers, over 60 plus asthmatics, and large health systems, payers, and chronic care management platforms, and they seem to be very interested in understanding how to use a remote monitoring device to better manage respiratory condition. Patients of the 60 plus that we've talked to, 92% believe that the device can actually help them improve asthma management. And 70% of them said that they would be willing to pay for this type of device, and they would pay anywhere between $50 and $150 out of pocket. The average was around $90, and that was primarily just based off of descriptions and photos of the renderings of our device. We have a B2C model approach to start with the long-term goal of being a B2B enterprise-focused model as well. We can provide the device to individuals for about $200 and $1.99 for a monthly subscription to the app, which allows you to track data and send that back to your physician via email. The progress of the technology, we actually came from the Jefferson Health Hack in 2015, where we started doing very quick iterations of the device, and then since then we've validated the proof of concept. We've done a literature review to understand that you can in fact identify wheezing and coughing using an audio microphone, and we've now built and prototyped a works like and a looks like version of the device and done product market fit testing. Our roadmap now, we've filed our provisional patent, we've done early stage product market fit, market validation testing, and now we want to optimize the device. And we're actually in a hardware accelerator now at NextFab that's going to help us get to the point where we can build a minimum viable product. We believe that we can launch B2C in 2018 and then B2B in 2019. Our management team understands this problem. I'm an asthmatic and Dr. Au is an asthmatic as well. and we all have different sets of skills ranging from business and health administration to clinical medicine, biomedical engineering, and data science. And our advisors are also focused in this area. They've spent their careers in population health and understanding how asthmatics in particular are served from a population health perspective in low-income areas, how to engage patients from a payer perspective and from a health system perspective to manage their health, and to build and create new medical technologies. We had the chance to compete in a business competition last year at Temple University, and we're finalists there, and again, we're now in a rapid hardware accelerator at NextFab. Strados Labs, we believe in 3 key things: doing something good, doing it well, and changing the way things are. And that's exactly what we're doing with Pulmaware. Thank you.
Nick, who's your competitors, and how do you stack up against your competitors?
So our current competitors directly right now, it's a company called Healthcare Originals, and they're creating a device called Atom. It's not yet in the market, but they are looking to get 510K clearance now. We actually have more elaborate algorithms for which we can identify certain sounds. They're focused only on cough counting at this point, and we're focused on not just coughs, but wheezes and other abnormal lung sounds.
Could you explain a little more about the problem? I mean, do people not know when they need to take their inhaler, or I guess why don't people know to do that?
It's a great question. The CDC did a survey a few years ago of asthmatics, and the results were about 50% don't even understand the signs and symptoms of asthma. Either they were never educated about it, or they just simply don't really understand what it means to be having an asthma attack versus labored breathing or exercise-related breathing. So that is a major problem, and self-management is a key piece of understanding how to better control asthma. It's not just about access to an inhaler and using that properly, but really understanding when you're supposed to do that. And that's what an asthma action plan asks you to do, is when you're wheezing, take your medications. But we talked to pulmonologists and primary care physicians, and they've even noted that a lot of their patients are just hypoperceivers, and they can wheeze all day long and never do anything about it. So,
Well, follow up then. So is the device going to tell somebody to take their medication?
It's not going to tell them to take their medications per se, but it's going to provide them with trending of lung health as it relates to wheezing, coughing, shortness of breath. And then we're actually doing more of a behavioral change type of notification, where we're asking people, how are you feeling right now, or how are you feeling today, to engage them with the application to say, I'm actually feeling okay, but it looks like maybe my trend line is going down. This could be a good opportunity for me to use my medications. Or it looks like I took my inhaler this morning, but I continue to have this downward trend line. Maybe I should get in touch with a care team to figure out if there's something else I should be doing.
Have you thought about maybe partnering with a disease management platform and having your application embedded in that platform rather than trying to get to the market as a standalone, which is tough?
I think I might have a slide here, yeah. So we've actually been working with a firm, chronic care management platform in New Jersey, and we're going to be in their New Jersey Health Cities pilot program in March of 2018. We were invited for the first round in September, but development-wise, we won't make it. But the idea is to actually create the device that sits on top of their existing chronic care management platform.
So just as so the actual device will remain on the person's body throughout the day. Is that correct?
Correct. Yes.
And there's no concern on whether or not this will be comfortable, or people will stop wearing it at some point.
So that's a great question. We're actually doing usability studies right now with a medical device development firm here called Smithwise. They specialize in creating and designing devices that are consumer friendly. So we have 30 asthmatics that we've already recruited, and they're going to go through each of the iterations of the final designs to figure out what's most comfortable and what people are most willing to use.
So what kind of claims do you want to be able to make in order to sell this, not just to get regulatory, but to get market adoption?
So market adoption, we want to create a better way to manage respiratory health. We don't want to say that we can prevent an asthma attack or early alert of an asthma attack today. That's more of the next iteration of what we're trying to get once we have better predictive analytics around some of the key inputs related to asthma health, environment, et cetera, medication usage. So today it's a better way to manage and monitor signs and symptoms of asthma, which is something that at least talking with many of our patients, they don't have that to their availability today. They only have ways to digitize peak flow measurements and things like that.
But what's the outcome you're measuring to know that they're better managing it? I guess I'm still trying to figure out the claims package.
So we haven't gotten to the full extent of the ultimate goal. Realistically, if we do a clinical-based study or a system-based study, we want to be able to reduce the risk of hospitalizations for those who typically are high utilizers related to asthma.
What number of the entire asthma population is included in that? Because it seems to me that this large number is probably not going to be buying this device. It's probably only going to be limited to this group of people that are truly at risk for these adverse effects.
So that's why when we thought about it from an enterprise level, we focused on, you're right, the highest utilizing patients. So this is, for example, a managed care case study where we essentially say, here are all of the hospitalizations related to asthma in Pennsylvania today, assuming every single person gets the device, which to your point is not the case. There's still an opportunity if you can reduce the risk of an asthma attack by 50%, which is high, there is an opportunity for cost savings. So if you can stratify that down to maybe the 10 to 15% of asthmatics who are in fact high utilizers in those plans, and reduce just a little bit, 5–10% of hospitalizations, there's an ROI. But consumer facing, there's ability to scale.
Thank you.
Thank you.